Yes. I have a question here by a commenter who's asking about substance abuse and mental illness. Hi, my name is Dr. Natalie Jones. I'm a licensed therapist. This person says, can smoking pot for some people lead into mental illness? Short answer is absolutely yes, it sure can. Long answer is, pot use can lead to symptoms. Pot use and pot dependency can cause people to have paranoia. Especially now, I live in California, so you can go to the store, specific stores, and buy it, and so. The different types of pot has different effects on people. So, for example, you can still get the marijuana cigarette, which you smoke, but you can also get the edibles and things like that, or the brownies and the vape and things like that. So the reason I bring that up is because it's not uncommon to hear people say, "Oh, the edibles made me extremely paranoid or tripping out," versus just smoking pot or something like that. So even just the different forms in which it comes in and how it's done can have a different effect on people. The other thing too is it could certainly create a dependency where people are just doing it all day, every day. They can't get through life without it. And so that creates a dependency where they feel like they can't come off of it. And so, and this is something that's been going on since I was in school. I mean, I'm sure a lot of you probably had a group of stoners and things like that, where people were just stoned all the time. And, what do you need to be stoned to come to school for? What is going on in junior high or high school that you need to be stoned for? It's not that serious, but you have people that would do it. They would leave during lunch break and go get high and just be stoned all the time. But also, too, in addition to that, there are people that don't just smoke marijuana, or sometimes they smoke marijuana with things mixed into it, such as PCP, K2, spice, and things like that, which has very strong hallucinogenic properties. So there can be all sorts of things going on with that, where people can experience a psychosis from that, and that is something that is very real. It's something I've seen many times over my career, where people actually have psychosis from that. Any substance has the potential to cause any sort of interaction with your brain and can cause mental illness. Some are a little bit more rare than others, but I also think substances that are very easily acquired, meaning that they're sold over the counter, has a lot of harmful effects to it. So I think, for example, alcohol is a very serious drug with very serious consequences, especially when people become dependent on it. It can just cause a whole host of things, but absolutely, smoking pot can cause mental illness and create dependency. Depending on where you live, there is also rehabilitation for people who have cannabis dependence. So thanks for asking that. Hope that helps. Like, comment, follow, and share. Thanks. Lastly, one thing that I will say too that I forgot to mention is a lot of times when you have people that are chronically addicted to smoking pot, they already may have mental illness anyway, or mental health issues anyway. And one of the reasons that they are, smoking pot so much is because they're trying to self-medicate. Essentially, they are becoming their own psychiatrists, or trying to, right? And so what that does in a lot of cases, by them attempting to self-medicate it, is it actually makes symptoms worse, and their tolerance level goes up, which means that they need more of it as time goes on, and they just prolong actually getting the assistance that they need for their mental illness. So they're kind of slapping a band-aid on it, but they may need more and more as time goes on to help them with the symptoms that they actually may not be working on through therapy or through the proper medications. Again, I'm sure there's going to be people out there, and I've been treating myself and I'm just fine, so but just so you put that out there, but or I smoke pot every day and I'm functioning, so I'm sure there's going to be a few naysayers, but it actually can make symptoms worse. Specifically, there have been studies on that in PTSD, and depression and things like that. But a lot of the people, also too, that I've known over the years, or worked with over the years, I should say, a lot of them have severe anxiety, and so pot helps them calm down. But when they're not taking it, their anxiety is much worse, or they're just like afraid of everything or a lot of things. But you need to actually work through coping skills and not just put a temporary band-aid on it with substance abuse, which is what a lot of people do. A lot of people use it to cope with trauma. Over time, if you don't treat the trauma and you just continue self-medicating, things will your mental health, mental illness may become more severe. The symptoms may be more severe. So thanks so much.